I'm very excited to introduce our next two guest speakers that are experts in their individual fields. The topic of today is health issues in terms of that we face, and either as individuals or perhaps as children looking at some aging parents. To my right, we have Helen Hu, President of Medisystem Technology, a major distributor of pharmaceutical products in long-term care and retirement homes throughout Canada. So welcome, Helen. And to Helen's right, Dr. Fabio Verlese, an Assistant Professor of Toronto, Specialist in Internal Medicine and Geriatric Care, Director of Acute Care Medicine at Baycrest Hospital. So benvenuto, Dr. Verlese. So earlier we talked about retirement homes and what they have to offer and so on. And so from your perspective, Dr. Verlese, what are the benefits of a retirement home from a medical perspective, given the social and physical nutritional programs that they offer? And give us some insight in terms of what you see in your day-to-day practice as a geriatric and internal medicine specialist.
So what's interesting is the so-called concept of compression of morbidity. What does that mean? Morbidity is the age of onset of chronic disease. There's a professor, James Friars from Stanford, who theorized that if we were to delay the onset of chronic disease to the year or two before passing, certainly quality of life would improve, healthcare costs would decrease dramatically, and perhaps we would even live longer. And that was confirmed later in 1988 by a study at the University of Pennsylvania where they looked at 1,700 alumni that were followed for 20 years. So we know that by focusing on living well and preventing disease, we will have an impact on quality of life and living long. Now, there's an emphasis in medicine today for helping people thrive well, live at home as long as possible, and help them stay out of hospital. But a time does come when there is a need for enhanced nursing care, enhanced programs that help people continue to thrive well. And so a retirement home, which unfortunately has a negative connotation from the past, but nowadays we know that retirement homes can be incredibly excellent from a point of view of they're boutique hotels many times, and they have programs that really focus on those factors that help delay the aging process and certainly the onset of chronic disease.
And part of that transformation is in terms of the pharmaceutical services that are now offered and available. So, Helen, from your perspective, what trends do you see with today's seniors living in retirement homes?
We're seeing great trends in the retirement living environment now. As the doctor said, it's very boutique living, and seniors, the baby boomers who are in these retirement homes now, are very well aware of what's going on, and they want the best of everything, and rightly so. So what we're seeing from a pharmacy perspective, at least, is we're working very closely with the medical staff in retirement homes to ensure even the prescribing doctors are supported by the pharmacy in terms of understanding what medications the residents are and should be on. We advise in such manners of that. And also with seniors, they have knowledge to all different kinds of medications, and they want to take medications that will improve their life and make their lifestyle better in terms of health, overall health. So they are aware of maintenance medications and also vitamins and herbals and holistic medications that they know will make them feel better and healthier. And with that, the pharmacy is readily available if this resident is living in a retirement setting to take a look at all the meds they're on currently, make advice on medications they should be taking on, and also we can advise them on how to take the medications. All those things a retirement resident can enjoy education on through the pharmacy.
And in my travels and looking at different retirement homes, it's great to see the relationship that a pharmacist has with the medical team, nursing team, But even with the resident, tell us a little bit about the services that pharmacists are now offering to residents and to retirement homes.
Well, the services involve that in a retirement home, there will be a dedicated clinical pharmacist. So a pharmacist will have an ongoing relationship not only with the resident, but also family members who are involved with the resident care, if they choose. And we also have an ongoing relationship with the medical staff that take care of the resident living in the retirement home. So there is a dedicated clinical pharmacist who will work with the resident. And in that comes all the benefits of making sure that dedicated pharmacist knows the medical history of the resident, what medications they were on, what diagnosis they have, what medications they should be prescribed. So there is that ongoing relationship at a high level for that resident living in the retirement home.
Thank you very much, Helen. So we have a question from the community to ask our expert panel.
What signs and/or medical conditions should people be aware of to help them decide in choosing a retirement home?
It's always very difficult for the kids or a spouse to make a decision or even understand when the right time is for retirement. It's a very emotionally charged task many times, but many times it's also related to not having the education, and that's why support systems are needed to help educate. I mean, we're not talking about things like benign forgetfulness. We all have that in our day-to-day, but forgetting things such as a stove that could be on and predispose the patient to incredible trauma, fires, and these are things that the families should start looking at. They should start looking at them forgetting their medications. For example, if they're on a narcotic medication, they may start having withdrawal symptoms. They may not understand that it was related to a drug, but eventually by seeking medical attention, they'll get the feedback from an MD, and basically they will start understanding that compliance with medication is starting to become a problem. And therefore, these are just some examples of when it becomes necessary to start considering a retirement home, where the existence of a nursing staff could help sort of compensate for some of these deficiencies that patients are having.
That's a good lead to the next question, and really that we face. So, you as a pharmacist, what do you do in order to kind of help seniors and also retirement homes maintain and achieve 100% compliance?
Of course, there's the packaging way of ensuring that, and seniors can choose to get their medications in vials if they do remember to take, and they're okay with the vial system. But our pharmacy will give options of either blister packaging, even dosetting it, even a multi-dose strip packaging, which each unit of medication that needs to be taken is provided in a separate pack, all joined together, so the resident can just rip off, or even the nursing staff or the retirement home staff can assist in making sure the meds are administered on time and not forgotten to be given to the resident.
So in layman's term, Helen, is that you even offer a packaging that looks like a bubblegum strip, and with
Yes.
the individual's name and time of
That's
day they
right.
should take
The
it.
name, the time, the quantity, the name of the medication, the description of the medication, and you can see the medication transparently in the packaging.
So, Dr. Verleze, back to you. What can Canadians do to achieve good health?
Well, we're aging. That's a reality, and in Canada, in 2011, more than 14% of elders were above age 65, and by 2040, more than a quarter of the Canadian population will be above age 65. So when it comes to the things that we do today, we really try to help people age in place. And so what are the things we do? We need to stimulate the mind. The mind is no different than a muscle. If you don't stimulate a muscle, it loses strength, it loses mass. The same thing with the brain. If the brain is not stimulated and retirement homes can offer all sorts of programs that stimulate the mind, structured programs. You will see that the brain will prevent the deterioration. Certainly social engagement is important for the mind, and retirement homes offer tremendous amount of programs that help this. People sometimes live in isolation at home, and so this is a significant aspect. I always talk about socialization and cognitive stimulation, and sometimes this is missing at home. Structured meal plans, physical activity programs that retirement homes offer. Very important to be physically active, because we know how positive the impact is on brain function. So the kids or the spouse really need to be educated about all of these benefits. And retirement homes do offer this today.
Alarming statistics that you've shared with us, important information that you have provided both myself and our viewers. So we want to thank the viewers for giving us this opportunity to really talk about the health issues that we face either as individuals or as children with aging parents. We thank you, and we hope that today's show on health issues really opened up a new set of questions for you to ask. So thank you to our wonderful guest, and have a great day.